Bismillahirrahmanirrahim. Today we will be studying ACL, anterior cruciate ligament. What is anterior cruciate ligament basically? It is one of the most important ligaments of the knee joint. As the word cruciate stands for the fibers of this particular ligament, they crisscross each other just like this. So that's why it is called cruciate ligament. And its basic function or purpose or significance is that it stabilizes the knee joint, and what it does is that it stabilizes the anterior drawing movement of the knee joint, and as well as it also resists in internal rotation at the knee joint. So it avoids these particular two abnormal movements. One is the anterior draw movement and other one is the internal rotation at the knee joint. What are the attachments of this particular ligament? So it is attached at the lateral condyle of the femur and intercondylar portion of the tibia anteriorly. So it is the attachment. These are the attachment of this ligament. Purpose I have already told you that it stabilizes the knee joint. And if someone, and it is this point is to be noted that it is the most common injury at the knee. Okay. So whenever some falls or twists his or her knee, so anterior cruciate ligament is the most prone. What are the special tests performed to diagnose? Physically, the most important test or the gold standard test that we perform to diagnose is Lachman test, and the other one is the anterior draw test. There is another one which we do with the help of a machine KT1000, but I am not going to mention that over here. So these two particular tests which we usually perform at our clinical setups, being a clinicians, one is the Lachman test, which is the gold standard test. We perform it usually by bending the knee at 20 to 30 degree and then fixing the femur, and anteriorly we draw the tibia outwards or forward just to check this. And again, anterior draw test, we flexes the knee joint at 90 degree, and then we sit over the foot on the dorsal surface of the foot, and we hold the knee joint and the anterior tuberosity, and we pulls out the knee joint anteriorly. This is what we will do practically, and I will show you people. Just for the practical purposes, you just need to remember the names, which are Lachman test and the anterior draw test. Investigations, it is again very important. You need to know what investigations will help you out to narrow your diagnosis, because knee is a complex structure. If someone comes to you with a trauma and you need to rule out all those things what it can be. So investigations, the most important investigation if you are suspecting someone of the anterior cruciate ligament would be MRI. Okay? Gold standard for this particular thing, anterior cruciate ligament, is arthroscopy. It can be diagnostic as well as the therapeutic. We can also repair the thing. Other investigations may involve X-ray, digital X-ray of the knee joint, taking a lateral view. If there is some bone involvement attached with the or associated with the anterior cruciate ligament. So for the bony purposes, we can get the patient's X-ray as well as the 3D CT scan done. Its main focus will be on the bony part. If we are assuming that there is some fracture as well as the ACL injury, then along with MRI, X-ray and CTs will be required. And arthroscopy is the gold standard. Ultrasound, why will get it done? The ultrasound basic reason is to see the surrounding soft tissues. If there is some swelling, afferent, so to know the amount of that and the particular areas for aspiration or some other purposes or hematoma, we can get the ultrasound done as well. What is the treatment option if you label someone as ACL injury? So the treatment option depends on the amount of damage done to the ACL ligament or anterior cruciate ligament. If it is a partial tear, so we will deal it with conservative treatment, and if it is complete tear, we will deal it surgically. So conservative is that for the first 2 to 3 weeks, up to 4 weeks, we will completely immobilize the knee joint. with the help of casting above knee casting, we can do that. Secondly, we can also apply knee mobilizers for 3 to 4 weeks, and then follow it by physical therapy. Physical therapy is done to strengthen the quads muscle and the hamstring muscles as well as the calf muscles, which will again stabilize the knee joint and help in recovery of the anterior cruciate ligament. So in most cases, if it is a partial tear, we deal it conservatively, lifestyle modification, immobilization for 3 to 4 weeks with the help of above knee casting or knee mobilizer, and then followed by the physical therapy for next 3 months. Complete tear, the treatment option is surgical. We can do orthoscopy, and then if it is diagnosed, then we can repair the anterior cruciate ligament. Okay. We can also use the grafts, semimembranosus, tendinosus, gracilis muscle. We can use the graft to repair the or reconstruction of the anterior cruciate ligament. So this is for today's topic. I have just summarized it for you people, and we have a patient of anterior cruciate ligament which we are dealing right now. So the special test and all other things I will be performing over there, and I will teach you people. And I'll also perform in my next videos the special test regarding the anterior cruciate ligament injuries. So take care until then. Allah Hafiz.